and Information, UNESCO. Dr. Ahmed Ogwel Ouma, Deputy Director, Africa Centers for Disease Control and Prevention, joins us from Addis Ababa, Ethiopia. Also joining us from Nairobi, Kenya, is Miss Natalie Fall, the Regional Communications Advisor, UNICEF East and Southern Africa Region Office, and Mr. Lee Mwiti, the Chief Editor, Africa Checks, joins us from Johannesburg, South Africa. Let's now turn to Dr. Moeti, who will tell us about a new initiative to combat the COVID-19 infodemic.
Thank you. Thank you very much, Fiona. And I also like to thank our colleagues in the APO. So good morning, good afternoon, and thank you all for joining this press conference. Bonjour, merci d'être avec nous pour cette conférence de presse. It is my great pleasure to announce the launch of the Africa Infodemic Response Alliance, or IRA. I'm really pleased to be joined for this conversation by representatives of the Alliance, which is hosted by WHO. So welcome to you all. Melissa, a special thanks for having got up so early to be with us today. This alliance, which is the first of its kind, brings together intergovernmental and governmental organizations, as well as non-state actors from across the continent. The Alliance members have spent considerable time formulating a shared vision and defined ways of working so that we are ready to hit the ground running. In Africa and globally, we faced an unprecedented dual challenge in the response to COVID-19. We're fighting a highly infectious, dangerous virus and highly infectious, dangerous misinformation. Addressing this new challenge and creating this alliance has been not a mean feat. It's been a lot of work to bring everybody together. News of the coronavirus has many people on edge, and from social media to street corners, people are hearing conspiracy theories and rumors on the origin of the virus, of its mode of transmission, and its severity. Misinformation harms people's physical and mental health. It increases stigma and anxiety. It threatens precious health gains and reduces adherence to preventive measures like the wearing of masks. During health emergencies, people need proven scientific facts to make informed decisions about their health and well-being. Through this new alliance, we will work with fact checkers and the media to correct misconceptions, address conspiracy theories and rumors, and with technical experts to make sure that people can access accurate, concise, and timely information. This is all the more important as cases this month compared to last month are increasing in around half of the countries in the African region, and countries are preparing for the introduction of COVID-19 vaccines. People are looking for clarity and answers to claims circulating online and among families and friends. Accurate information saves lives, and I would really like to appreciate all the partners joining this alliance through our collective action with the media, communities, and technical experts. We can stop the spread of the infodemic, which will contribute to stopping the pandemic. So again, thank you all for having joined us today, and I look forward to an exciting discussion. Thank you.
Thank you very much, Dr. Moeti. And to our listeners, to ask your questions, please use the Q&A feature mentioning your name and outlet. Anonymous questions will not be answered. Let us know if you want us to take your question live, and we'll also give you that opportunity. And to access the audio feed in another language of your preference, please click on the interpretation feature, the globe at the bottom of your screen, and choose the language you'd like to hear. So the UN Secretariat was among the first to mobilize around responding to the infodemic. USG Fleming, we turn to you in New York to tell us about the Secretary General's verified initiative and the role that the UN Global Pulse is playing in the fight against health misinformation.
Thank you so much. And it's really great to be with you. Hello to everybody. I'd just like to give a little bit of the backdrop. You know, when the COVID-19 pandemic hit the world, I mean, we realized that we were faced with an unprecedented global public health crisis. But at the same time, it was clear to us at the UN, and I think I'm sure at WHO as well, that we were facing an unprecedented communication crisis as well. And why? Because this was the first pandemic in the social media age. Now, social media offers a great opportunity. We can, like never before, we can distribute good public health guidance to people all across the globe in all corners of the earth. The problem is, and this is why WHO defined this term infodemic, we're living in a polluted landscape, a polluted media landscape that has toxic misinformation and disinformation mixed in with the good information. And the result is that you have a public that is searching desperately as the coronavirus is spreading for guidance that will help them to navigate. And what they're finding is very confusing. What we found very early on also is that there wasn't really a lack of information by public health bodies and organizations. It was just that it was not very entertaining or engaging or consumable in the places online where people get their information. And in fact, the purveyors of misinformation were much more slick and really understanding the social media algorithms and how information these days spreads, which is peer-to-peer and in groups. And we're really kind of occupying that space. So either people were facing a kind of data deficit where they weren't finding the information they needed that was trusted and good, or they were being led down rabbit holes of dangerous misinformation. So that is why we decided to launch an initiative we're calling Verified. It wasn't enough for us to just, repackage our information and put it on UN platforms and channels. We really needed to fight an information war. And Verified is an initiative really to fight this growing scourge of misinformation by increasing the volume, the energy, the appeal of the content around the COVID crisis. And at the same time, to educate people around the world about misinformation, to increase social media or media literacy so that people really understand and can navigate better through this very confusing ecosystem of good and mixed with bad information. So we work, across the UN system with governments, media, partner with social media platforms and the private sector. And one of the exciting things about this initiative is we were able to also recruit what we call information volunteers, or others like to call themselves, or those involved, digital first responders. We have over 110,000 already signed up, who have educated themselves through our daily emails on misinformation and how to spot it and what to do with it. And they also have volunteered to help us share our content that travels well across social media. And so through all of these measures, we've reached over 1 billion people in 100 countries with this content. It's all available. Check it out, members of the press. It's on shareverified.com. And just to note that in June, we launched also a specific campaign called Pause. And this is to get individuals to pause and then take care before you share, to have this kind of mantra in the back of their mind when they're faced with a post on their social media or on their WhatsApp that is making them feel either overly hopeful or emotive, heart is palpitating. Take a break, pause, look at it, look at the source, and scrutinize it before you share it on, so that there's individual responsibility that's being introduced. Now, just a couple of other points. As we get closer to the availability of a COVID-19 vaccine, which is so exciting, We are also ramping up efforts on vaccine confidence and access. As soon as all the good news hit the headlines about the COVID-19 vaccines from a number of countries, misinformation around the vaccine started to surge again with crazy conspiracy theories, saying that it's going to change people's DNA or chips are going to be inserted in people's bodies. I'm sure that you have heard all of these theories. They're also circulating across Africa. So we're really trying to build vaccine confidence together with WHO and Gavi and other organizations. Just very specific to Africa, we have been working with media partners across Africa, both on the distribution of content on public health, as well as to fight misinformation through media literacy. A couple of partners, just to note, Wazobia Radio in Nigeria is running regular PSAs for us in 5 languages in 5 major Nigerian cities. And we believe that this has allowed us to reach 60% of the Nigerian population with this information. So just an example. We have also a partner, Accountability Media, that is allowing us to reach 27 million people in 6 African countries with our PSAs in 9 different languages. And then finally, a really important partnership I wanted to acknowledge here is with MultiChoice Africa. I'm sure you know it. It's the multi-country entertainment company and network that is airing our public service announcements, is sending out SMSs to their subscribers, and is even producing content with their MultiChoice Talent Factory to help really spread good information across Africa. Finally, just to note, WHO has partnered with an initiative by the Secretary General called Global Pulse. It's called UN Global Pulse, and it's our big data and artificial intelligence initiative. And this is really to look at real-time and predictive insights to protect vulnerable communities in times of crisis. So no better time than now. And they have, with WHO, been focusing on projects to develop norms and standards to measure the extent and impact of the infodemic's spread by developing new social and digital listening tools. So they're really out there figuring out what people are talking about, what people are sharing on social media, not just on social media though, but also over radio, which is really important because not everybody is getting their information from social media. And they're also providing guidance for how to counteract misinformation and disinformation. So that's all I have for now. And thanks for bearing with me and look forward to your questions.
Indeed, that sounds like fighting a war. Surely the COVID-19 infodemic is exacerbated through social media, but it's not just spreading online. Dr. Ben Adaze, tell us about IFRC's work with communities.
Thank you very much for the invitation to be part of this meeting and press briefing. We really appreciate this from the International Federation of Red Cross and Red Crescent. First and foremost, something we all know and agree with is that epidemics starts and ends in communities. And it's the actions of our community members that will either end or sustain an outbreak. So that's why we at the IFRC, we need the active support of communities to stop the transmission of cases and keep the number of cases from rising. And communities, from our perspective, are experts in their own context because they know better than any of us how to successfully implement contextualized prevention measures. So that's why we always try to move beyond static messaging and work in partnership with communities, listen to their ideas, identify community-led solutions, and support communities themselves to implement these solutions. If communities do not trust us, They will not listen to whatever health advice we give to them, or follow measures like wearing a mask, or feel safe keeping or seeking treatment, or even accepting the vaccine that we're talking about. So that's why the Red Cross has invested heavily in collecting qualitative, open-ended feedback through our trusted network of over 1.6 million volunteers across Africa. These are people who live within the communities and are part of the communities we serve. So we collect data using simple coding framework to categorize and analyze this data based on the trends and key topics that people in the communities are talking about, or the misinformation they are expressing, so that we understand their perceptions and the beliefs and attitudes of these people and what they are sharing with each other. This enables us to be guided by communities themselves and to change our approach to activities to show that we are listening to them, which I think is very important. And lastly, changing what we do, and not just to say what we have conceptualized, really requires everyone's engagement and involvement. And we believe at the International Federation of Red Cross and Red Crescent that this is the only way that we could together build trust that is so critical for any success in achieving an end to this pandemic or any outbreak in general. So these are the few words from us, from the Red Cross, Red Crescent, and thank you so much. I will be available or ready to answer questions from the journalists. Thank you.
Wow, 1.6 million volunteers. Thank you very much, Dr. Deiza. Would like to thank you very much, our speakers, and want to remind you to keep our comments quite brief, because we'd like to give chance to our reporters who are listening in to ask their questions. I now move to Mr. Guy Berger. Can you please share with us the work that UNESCO is doing in the field of misinformation literacy and journalist training?
Yes, thank you, colleagues. It's a pleasure to be here and be part of this alliance. At UNESCO, our concern is based on the following observation. This is that where there's a shortage of open, public, and reliable information, then you have fertile fields where the falsehoods can flourish, especially on private channels like social messaging and without any credible counter. So in short, if a society does not have a free and vibrant media system and an educated audience, then the weeds of disinformation and their poisonous seeds of fear and blame, poisonous seeds of rumor and social distrust, all of these can grow tall. On the other hand, a society that allows and supports a plurality of quality journalism outlets enables there to be an informed rather than misinformed public, which has the possibility to assess truth based on a diversity of sources. So that's why UNESCO, with support of partners like the European Union, we bring to the Alliance expertise in 3 areas: work with media, governments, and audiences. And all of this helps to prevent the impact of disinformation and misinformation. So with media, we support the supply of quality information. We train journalists and support community radio for producing content in local languages. Recently, for example, we supported training of 300 women journalists in 7 East African countries in health reporting. And we work with many community radio stations around the continent on how to debunk disinformation. And we provide audio resources in French, English, Swahili, and Mandinka. That's media. With government, part of fighting disinformation requires that the governments should not only protect press freedom, but also implement the public's right to information by proactively publishing data, for instance, data about contracts being awarded in the fight against COVID. Some African countries have shown well what can be done here, and UNESCO strongly promotes this area of work in open governance as a factor in the fight against disinformation. And finally, audiences. At UNESCO, we have extensive experience in working to increase the awareness and skills of the audience so that they can use critical thinking to distinguish information from disinformation and to think before you share. We call this form of empowerment media and information literacy. And we support education ministries to get this into the curriculum, and we support others to play their part in informal education. In conclusion, the problem of disinformation today is very visible in regard to healthcare, and looking ahead, it will be a key issue around vaccinations. But of course, we all know that disinformation is also a problem in terms of things like combating climate change, in terms of the integrity of elections. In fact, building public access to information, as the SDGs call us to do, building this public access to information as a counter to the flood of disinformation, this is something that's important for all the Sustainable Development Goals. So at UNESCO, we are very happy to partner in this alliance with people interested in resisting the disinfodemic in health, because our success in this field is critical, but it can also be a model for other parts of social life, where disinformation contaminates politics, issues such as how we understand migration, conflicts, where on the whole, disinformation is an obstacle to the Sustainable Development Agenda. Unfortunately, I do have another commitment, but my dear colleague Guilherme Canela is here to take any questions from the media. And with that, I thank you for listening to me, and I pass back to the chair. We look forward to this alliance. Thank you.
Thank you very much, Mr. Berger. Et pour envoyer vos questions, merci d'utiliser la fonction QR et de mentionner votre nom et média. Faites-nous aussi savoir si vous voulez que nous prenions votre question en direct. Africa CDC is playing a key role in researching the impact of infodemic. Dr. Ahmed Ouma, could you please shed some light on that?
Thank you very much, moderator, and it's really a pleasure to be part of this media briefing today at the launch of the Africa Infodemic Response Alliance. Information is really very important for our daily lives, but when that information is not accurate, it becomes harmful, particularly in the context of public health. When health information is corrupted, it becomes, it has the capacity of not just affecting lives, but also claiming lives. And as we've seen over the years, bad information thrives in the absence of good and credible information. Unfortunately, though, bad information tends to spread a lot faster than good information, particularly today with the help of the internet and the various social media platforms. So when we say good things, they sort of end up in the media, but then when bad things are said, they're shared across these platforms at a very, very fast rate. It is for this reason that we have to commit and actually do a lot of monitoring, so that the kind of information that is spreading across not only our continent, but globally, and affecting public health issues can be able to be robustly responded to in a timely manner. At Africa CDC, we believe that authentic information should be based on good evidence, indeed, good scientific evidence. And this is what we've always been advocating for since our inception about 4 years ago. From the beginning of this particular pandemic, really, we have witnessed not just misinformation, but also disinformation, a lot of it willful. We have seen it affect people in the way that they respond and comply to advice from public health experts, and also to public health measures that are put in place by governments across the world. We as Africa CDC set up a rumor monitoring system so that we could be able to see what kind of misinformation and disinformation about this pandemic was being shared across the continent. We've picked up a lot actually during the last 8 months or so. We have seen people alleging that COVID-19 as an illness actually does not exist. some saying it is just a plot by various government officials to siphon money from the public coffers. In fact, we have seen some even claim that this virus is not that deadly, and we don't need to give it so much attention. Such information is not only misleading, but it actually affects the progress that is being made by governments on the continent and across the world, by various organizations, including those who are represented here today, and makes it that much more difficult for us to bring this pandemic under control. Monitoring in these infodemics is very important, not only for COVID-19, but for all other public health challenges that we are facing in the world today. This alliance that is being launched today is a very important platform where we can be able to ensure that members of the public are provided with clear information, and we can be able to monitor any shift in discussions across the globe which are devoid of scientific evidence, and it allows us to trigger appropriate response in a timely manner. As Africa CDC, together with other partners, we formed the Partnership for Evidence-Based Response to COVID-19, in short known as PARC. Some of those organizations are represented here today, including the World Health Organization, Resolve to Save Lives, the UK Public Health Rapid Support Team, the World Economic Forum, Ipsos, Noveta Mission Analytics, and many others. And this particular partnership is collecting social, economic, and other data that we are using to provide actionable recommendations to governments and other policymakers to ensure that we can be able to respond effectively to this pandemic. We as Africa CDC and the Africa Union have also been supporting the collection, analysis, and dissemination of real-time data, and we are working very closely with our 55 member states on the continent to use evidence-based information to inform the public and to provide policy guidance for public health action. Joining forces together as a continent, indeed as the whole world, to give one voice has enabled Africa to combat this pandemic in a more effective way, in fact, in a most effective way compared to other actions we've had in the past. This alliance is therefore a much larger partnership that will provide a new dimension to the response of misinformation, not just here in Africa, but globally as well. As Africa CDC, we are delighted to be part of the alliance, and we commit to work with all partners to ensure that this alliance achieves its goals and objectives in a timely manner. I thank you, and indeed, we are looking forward to the coming days tackling the misinformation and disinformation about public health measures in general and COVID-19 pandemic in particular. Thank you.
Thank you very much, Dr. Ouma. And I would like to remind our panelists to try and keep the comments short, brief, because we do have a number of questions from the journalists and would like to interact with them. And so UNICEF is at the forefront of addressing misinformation. Ms. Natalie Fall, could you highlight the work that UNICEF is doing on online rumor monitoring?
Thank you very much, and I'm very pleased to be here today on behalf of Mr. Mohamed Fall, UNICEF Regional Director for Eastern and Southern Africa. As we all know, the importance of data-driven public health measure, and in particular in risk communication, has been underlined since the early stage of the pandemic. Listening to communities, both on digital and offline, is of critical importance, not only to capture people's concerns, but also to understand whether they are exposed to inaccurate information. As already highlighted by other panelists, this exposure has a strong potential to negatively impact on people's decision to comply or not with preventive measure, and on their level of trust in the health and immunization services. UNICEF has made significant investment in the 21 countries in Eastern and Southern African region to enhance social listening as a key tool for effective RCCE. One aspect of this work has involved setting up systems to support countries in tracking rumors around COVID-19, both those circulating online and those captured through community-based platforms or networks. We collaborate with a number of partners, but I'd like to highlight here our partnership with religious leaders. As influential and trusted members of their communities, religious leaders are well positioned to address concern at the onset, and they can empower the community with accurate and actionable information. Reinforcing their skills to identify and react to misinformation is one of the key focus of this partnership. This is a new but very fast expanding area of work in UNICEF, and we look very much forward to joining forces through the Alliance to collectively limit the spread of harmful health, misinformation and disinformation. Thank you very much.
Thank you very much, Natalie Fall. Mr. Lee Mwiti, could you now shed some light on the crucial role of fact-checking organizations and civil society in the fight against COVID-19 misinformation?
Thank you, Dr. Atuhabwe, and thank you to my esteemed panelists, and my warm regards to everyone who is part of this launch of a very exciting initiative that has Africa at its vanguard. By way of a quick background, Africa Check is a continent's leading and first independent fact-checking organization. We work directly in 4 African countries: South Africa, Kenya, Nigeria, and Senegal, and also partner with and support other several fact-checking organizations around the continent. So we're therefore very honored to speak for the African fact-checking community today. It is an interesting coincidence that our reason for existence as Africa Check is rooted in a public health crisis, not unlike what we have faced this year. In 2002 and 2003, false and misleading information led to vaccine refusals and the stalling of a polio immunization campaign in northern Nigeria, the harmful effects of which continue to be felt in other parts of the continent for years. Indeed, it was just 3 months ago that the World Health Organization's Africa region was certified as having interrupted the transmission of all indigenous wild polioviruses. Perhaps it is easy to say that with the passage of time, the environment that fostered and allowed vaccine misinformation to take root at that time has changed. After all, channels of accurate information were not as diversified and accessible as they are now. But look closely enough and you'll find that many of the contributing factors remain in place: the worldviews, the narratives, the relationships and social networks, the top-down interventions, geopolitics, just to name a few. It is also important to remember that at its core, false and misleading health information is about issues that people care about, and not to dismiss bad information as a product of poor literacy, for example. It is therefore our job as fact checkers to recognize these motivations, understand the narratives around them, and to then cut through the resulting insights in a way that has a rich and meaningful impact on the public's understanding of the health issue. But we are very aware that we cannot do it alone. Collaboration is crucial if we are to have a chance at informing decisions, whether at a national, community, or personal level. This is why, as the fact-checking community, we're very keen to leverage our considerable strengths as part of this multi-stakeholder alliance. We also hope that our work on this partnership will contribute to the emerging field of infodemiology and better inform approaches and responses to future health emergencies that are appropriate for this region. Thank you.
Thanks a lot, Mr. Mwiti, and thanks a lot to our panelists. And now that we've heard from all of you, it's the turn for our journalists to come in with their questions. And please remember to do this. You can use the Q&A function in the Zoom application. I now want to go straight to Naftali Mwaura from Shinua, Kenya, to go live with your question.
Hello. Oh, hi, Fiona. Can you hear me, Fiona?
Yes, Naftali, I can hear you.
Yes.
Kindly go ahead.
Yeah, sure. My question goes to Dr. Moeti. I just want to know how widespread is the charge of misinformation about this pandemic in the continent, and maybe which countries are most affected, and also the kind of interventions that are in place so far to root out this challenge. The second question, a quick one, is about the vaccine. Do we have disinformation going on about the COVID-19 vaccine?
Okay, thank you. Thanks very much, Naftali, for those questions. Well, we do know that a lot of information on COVID-19 is circulating on digital platforms. For example, information about the virus has been shared and viewed over 270 billion times in the African region since the beginning of the pandemic. But it's difficult, we're not yet able to say how much of this is misinformation. However, fact-checking organizations in Africa say that they have debunked more than 1,000 of such misleading reports since the pandemic began. Then quantifying the reach and impact of misinformation is very challenging and is an area of research that the Alliance is actively working on to better understand. It's difficult because misinformation spreads widely over private messaging platforms like WhatsApp, for example, where it's very difficult sometimes to track. Countries most affected, I think it's those mainly with the highest internet penetration and which also have media hubs. So it's countries like Nigeria, Kenya, and South Africa, which are at the highest risk. A number of rumors coming from the global north have been amplified significantly when they were mentioned in those countries, leading to spillover to other countries. And I guess I can link this up a little bit with something that happened around vaccines, which unfortunately arose out of a conversation between two scientists from a Western country who said more or less Africa is virgin territory in terms of some health markers where it would be good to test out the vaccine. And this was interpreted as an intention to use African people as guinea pigs, more or less, in producing vaccines. And, you know, at that time, there was a strong belief that these vaccines would not be available to African people. So it was just one unfortunate example. Any programs, interventions in place to root out disinformation? I think we've heard from our partners already, from what the panelists have said, what it is that different organizations are doing in order to identify and tackle misinformation. And what is very good about the Alliance is the way that it's going to bring all of this together. So there's kind of complementarity and synergy, and strategic coordination is one of the key areas of work that the Alliance is going to be working on. And then in addition, starting from next year, we are going to be working with countries to make sure that similar coordination mechanisms that are available at the regional level are mirrored at country level. And perhaps Melissa and Guy would like to give further details about the initiative they're working on. But I mean, I think in the introductory statements, we heard a lot, and it gives us hope that these complementary approaches by different partners from their different perspectives are really going to come together to make an effective combination against the infodemic. Thank you.
Thank you very much, Dr. Moeti. Over to you, Ms. Fleming, to give. It would be interesting to hear your comments on the same, and as in the measures you've put in place.
No, thank you very much. Also, just to compliment Dr. Moeti, because she really covered, I think, most things. But we're placing a real particular focus on building vaccine confidence, as I flagged, and this is an issue across the globe. Interestingly, it's most pervasive in countries in the West, in the US, and in countries in Europe. It seems that in Africa, you know, people are more accustomed and more already, you know, have already been very embracing and understanding of the wonders of vaccines and vaccination. However, I think as Dr. Moeti flagged, what we're really concerned about is that these pieces of misinformation about that are created in the US or in the UK, or they're traveling and finding some fertile ground in Africa as well, and coming into a climate where vaccine hesitancy was not that huge an issue. But it is, and I hope maybe Dr. Moeti can confirm this, it is a growing issue in Africa, and it's a big concern. So we have two concerns. That one is that we won't have enough people to actually take the vaccine, so that we won't be able to create herd immunity, because people are listening to this misinformation and are becoming fearful. And our second concern is that there will not be enough availability of the vaccine. We are really calling for a people's vaccine, a vaccine that is available to everyone, everywhere, and at the same time. I mean, we just celebrated World AIDS Day, and we are all aware of the past when therapeutics became available, that they were most available first to the rich countries or people who had means, and the poorer countries had to wait unacceptable amounts of time and costing unacceptable numbers of human lives. And we do not want this to happen. The Secretary General has been insisting on this, Dr. Tedros as well, Dr. Moeti as well, that we have this COVAX facility that is there to ensure equitable distribution and access. And at the same time, this initiative has to work immediately and robustly on creating the confidence so that when the vaccine is available for distribution, that people can trust it and feel that it is safe and be willing to take it. Thank you.
Thank you. Now let's go live to Kara Ena from the Associated Press. You have the floor.
Hi, thanks for the briefing. Someone had already asked the question I was interested in also, like the countries where this problem appeared to be the most serious. I guess I wanted to follow up and ask whether there's some special frustration in knowing that it is the countries like South Africa, Kenya, Nigeria, where the middle class might be the largest and strongest, where you're seeing this information spread. Is there any special frustration in seeing that occur?
Thanks, Kara. Could I pose this to our UNICEF colleague from East and Southern Africa?
Yeah, thank you very much for the question. I do believe that the concerns that are raised and that are captured on social media are very much linked to what is also heard on the media. So there's a lot of question on the miracles and the potential things that you can absorb to cure COVID-19. There's also a very high number of questions on wearing masks and potential risks, etc. So I'm not too sure if it's linked to certain classes in society. I think it's a question that people are basically highlighting and building on some wrong assumption for misinformation, and building on pushing some discussion to very extreme points for conspiracy purposes, etc. So I'm not sure that we can really feel this specifically frustration from certain group, but I mean, this is something that can still be searched, and maybe the Alliance can look into this.
Dr. Deiser, would you like to weigh in on this too?
Thank you very much. Maybe I will just follow the part of Natalie to say, I think maybe it's not an issue of pinpointing a particular social strata, but from our perspective, the experience we have seen is the repetitiveness of this information coming, misinformation coming from our levels and at all times. From our experience, some issues we may have addressed in the past still reoccur, and it's irrespective of the social strata, because as you know, as Red Cross, Red Crescent, we work with communities. So our volunteers hear these things reoccurring, but at the village level, on social media and via radio networks where they carry out their awareness raising activities. So I think it's across all social strata, and the repetitiveness of these misinformation is what I think is a concern and a source of worry, and why deeper engagement is really necessary across all social strata, I would say.
Excellent, IFRC. We have a question from Constance Mananga from RTNC in DRC, directed to Dr. Moeti. Do you think that Africa should fear this second wave of COVID-19 that is happening in the West? Will Africa experience a new peak as well?
Yes, that's one of the questions of the day. You know, we've seen that, first of all, the situation in Africa did not evolve as had been feared or even projected and predicted. And our colleague from the Africa CDC stated very well the kind of strong actions that the governments took early in order to prevent that happening. We saw a peaking of the pandemic and a decrease in the number of daily cases. But we're very concerned now that we are seeing, and it's partly because some of the lockdown measures are being eased in countries because of the very severe economic impact. People are moving around more. And frankly, people are fatigued. So this is something else that the information needs to really address. People are fatigued of day to day in a sustained way, keeping to the prevention measures, wearing a mask, social distancing, and hygiene. So we have seen in the past few weeks a kind of leveling off of the rate of decrease every day, which was making us very encouraged that, oh, we're going in a good direction. And now in the past few weeks, in the last 3 or 4 weeks, we've seen an increase in the daily number of cases. It's not yet dramatic in terms of the rate and speed as to be called a second wave. And here I think we need to look at different countries differently. Certainly in some of the North African countries, in Algeria, in the Moroccos, which are not in our region, but they're on the continent, we are seeing rather rapid increases similar to what is happening in Europe. They've entered into their winter, people are sitting indoors more, and the distancing is a bit more of a problem. We're also seeing in South Africa, which had a good decrease in the past few months, now a leveling off and an increase in some hotspots, places like the Eastern Cape. There are also a number of countries, I think Kenya had an upsurge, which has started to slow down, Ethiopia as well, countries like Mauritania. So we see a diverse picture, but overall, not the steady reduction that had happened, at the very least a leveling off and a worrying uptick. It's very worrying because we are coming up to the festive season where there'll be a lot of things happening, movement. People are going to be traveling to be with their families over Christmas or to celebrate the New Year, gatherings, both religious gatherings, family gatherings, and as I said, coupled with the observed fatigue in the observation of the measures. This is worrying, and it just emphasizes the need not only for this alliance on the Emphademic to make sure people have the right information coming through a trusted source that will help them to do the right things, but it really underlines the need to get in there, be with people at the community level, in their networks, and encourage them to sustain some of the measures, even as we accept that the separations of the past year have, for many people in communities, become difficult to continue. So this is today's challenge. Good question.
With the upcoming Christmas season, we know that in Africa, we are in for it. I would like to hand over to Dr. Ouma from Africa CDC for you to weigh in on this second wave question.
No, thank you, Fiona. And I totally agree with Dr. Moeti on the pace at which the numbers are increasing now. In fact, when we unpack the continent, we find a very diverse picture in as far as the numbers are concerned since we peaked sometime in the middle of July. A few countries are driving the numbers, and this can provide a picture that the continent is suddenly not doing as well. But most countries on the continent are still keeping their numbers quite low. What I would add is looking at the effect of the public health measures that were put in place earlier in the pandemic. We know that they work. And rather than focus on numbers going up, we should be focusing on keeping the numbers low. And that means that continuing to advocate with members of the public that your mask really is a huge tool in as far as keeping yourself and the others safe is concerned, keeping your distance, washing your hands, ensuring that you are monitoring your your medical situation, if at all you have a cold or a cough. It is very important that the public health measures are kept up front so that we keep these numbers low, particularly as we enter into this very active season of the end of year holidays. We do expect that the numbers will go up, but we still do not expect that it will be in the rate that we are seeing in Europe and North America, because our message in Africa has actually been resonating quite well with members of the public. And as we open up the economies, if we keep that message and we keep the public health measures up front in our actions, we should be able to keep the numbers low into the new year. Thank you.
Thank you very much. And we have a question from Reuters' Tanisha Heidberg, directed to Dr. Moeti. How are African countries, many of which don't have reliable power, preparing to distribute vaccines that require ultra cold storage?
Yes, that's a great question. Well, you know, we celebrate the possibility and the reality now of vaccines to deal with this pandemic. And we've started in WHO to work with countries, first to assess their readiness and then to develop their preparedness plans, looking at the different components of what a sound plan for the delivery of the vaccine will look like. And indeed, one of these is in the area of logistics, including the cold chain and the ability to keep the vaccine in such a state that it is efficacious, it remains efficacious. You know, among the vaccines that have reached the final stages of being tried out, there is a range in terms of the demand for ultra cold conditions. So the Pfizer vaccine is one that requires -70 degrees. That definitely would be a challenge for most African settings. And it probably will be a challenge in other regions as well. And then the Moderna vaccine requires -20 degrees. It is less demanding. And then the AstraZeneca Oxford vaccine is one that can be kept and it will continue to be efficacious and be able to be used under the conditions of the cold chain systems in African countries today. Not to say that having to roll out a vaccine at these kind of volumes to try to reach eventually, not initially, about 60% of the population is not going to be hugely challenging. The COVAX platform, which was mentioned by Melissa, has actually discussed and reached agreement with the AstraZeneca, and there's conversations going on with Moderna. So by good coincidence, African countries are very invested in a mechanism or a platform that's going to have access at the very beginning to a vaccine that is more suited to the conditions. There will need to be a lot of investment, and that's why we're working with countries now to see what are their plans, what is the resourcing, what additional means and capacities need to be put in place, because we would like African countries, starting with the highest risk people, to have access to and to use these vaccines right from the beginning, like other countries.
Thank you very much, Dr. Moeti. We know we need to end this session because a number of the panelists need to leave, but we have one final question from the journalists. Our UNESCO colleague, could you please tell us where to get good information in this era of infodemic?
Thank you. Good afternoon to you all. That's a very good question. We need to obviously identify reliable information sources from different ways. So, for instance, the Verify campaign that Melissa mentioned is one of these. The World Health Organization sites or the websites of the different organizations that are members of the Alliance are also good sources of information. But I would like to tell you that UNESCO, with the World Health Organization and our chair of journalism in the University of Texas in Austin, Austin, we launched earlier this year a MOOC, a massive online course for journalists that was already attended by 9,000 journalists from 162 countries. Most of the African countries had journalists participating. This MOOC is available online in several languages, and there you can find lots of different sources of reliable information. And just a scoop to you all, together with the World Health Organization, we are preparing now a similar massive online course on the issue of vaccines. This will be available quite soon, and obviously we will be informing the members of the Alliance and this group of this tool that will be part of the synergies that we are creating here today. Over to you.
Mr. Limwiti, could you also kindly weigh in just a few seconds as we close down?
Absolutely, I'd be quick to say you can get accurate information from fact-checking organizations. I think it was mentioned we, as about 15 or so fact-checking organizations on the continent, done probably 1,000 fact checks during the peak of the first wave. But we are also a member of the International Fact-Checking Network, which brought together about 100 fact-checking organizations in 70 countries to tackle the question of misinformation. And we were able to do almost 10,000 individual fact checks of misinformation related to the pandemic. So I would be obviously very quick to say we are also a good source of accurate information. But also I think the media also has a role to play in identifying and monitoring problematic information that they can bring to the attention of the Alliance for us to take a closer look at.
Thank you very much, and a great thank you to our panelists for joining us and all you, the reporters, for joining us.